Good morning, everybody. It's Dr. Pearlman. I hope this audio comes in good. I hope it comes in clear. And one of the things I wanted to do today was start off the day with, really what I should be doing for my viewers all the time and what I should be doing for everyone all the time as a doctor of chiropractic, as a healthcare provider. It's that I should be educating. And I think there's a lot of real problematic material, if I'm being honest, with chiropractors. God bless even the way that I started making a lot of, consultation videos where probably people are really viewing because they want to see the adjustments, which turns it into this like crack fest. And there's no real value driven other than just people being like, wow, ooh, that looks like it's great. It's awesome. It's satisfying. People love to say it's satisfying, ASMR and all that. And the reality is that's great. And chiropractic is phenomenal. I wouldn't have become a chiropractor if chiropractic did not do wonders for me in my life. And there's so much of my early podcasts and so much of my early videos on YouTube that talks about my story. So I'm not going to really go deep into that, but I do want to talk about a lot of really misinterpreted information that gets mentioned by a lot of doctors and providers and influencers out there when it comes to chiropractic versus exercise, or chiropractic versus physical therapy, or chiropractic versus conventional medicine, whatever that means, or chiropractic versus massage. And I could continue to go on with a lot of the comparisons. But what I want to do is take the one that's a little bit most obvious, and a lot of these like evidence guided or evidence based providers in any field of healthcare kind of lean on, and that's chiropractic intervention or modalities or manipulation, really. We'll just say chiropractic manipulation versus exercise alone. So let's talk about that. Number one is a passive modality, meaning chiropractic does the passive modality to the patient, right? We push on the spine and something goes pop, pop. Gas release from the spine, the facet joint being manipulated. And then the other one is an active therapy. So right away, what we have is two contrasting things. They're not really synergistic, even in the sense of like, that's probably not the right word, but they're just not the same thing. You're going to say that one is an active thing and the other one is a passive thing. And somehow we're going to compare them because the study says, or this was shown over whatever amount of time. Aha, time. Let's talk about that because nobody wants to talk about it. So I'm going to talk about it right here. The common denominator to these studies that's not even really acknowledged in the conclusions or in the results or in the methods is the time. I mean, it's mentioned. It'll say over the course of 6 weeks or over the course of 3 months or over the course of whatever, this many people, these ones received chiropractic alone or chiropractic manipulation for their lower back pain or their hip pain, and then this population did exercise. But what's unbelievable is that it's not even the most commonsensical part of the equation, and that is time. What would happen if you did 6 weeks of chiropractic and 6 weeks of exercise? I promise you that as long as you didn't have the most debilitating type of back injury or neck injury or shoulder injury or whatever part of the body was being studied, time is going to heal you. And, we're not going to get into healing and, injury versus hurt and pain, subjectivity and all that. Let's just talk brass tacks about what's going on. Are you ready? Here we go. I'm going to make it as simple as I can for everybody out there. A part of the spine that controls the nerves that innervate all the rest of the joint, the fascia, the various muscle, whether it goes down the leg, called radicular pain or radiculopathy, from the back to the leg, whether it's from the neck and it goes down to the shoulder or the arm. And believe me, I've seen so many people with shoulder and arm pain when you adjust the neck and work on them a little bit, little soft tissue modality, and boom, they get better. Because everything kind of stems from the brain spinal cord connection, right? Brain to body, body back to brain. I say it all the time. So in the simplest of terms, if you have pain and you go and get a chiropractic spinal manipulation or adjustment, same thing, okay, everyone? Same thing. Obviously, the more specific, the better probably matters in my clinical experience. I have no evidence to prove it, but I can tell you that being specific matters. And when I say that being specific matters, it really means think of the actual nerve that you're trying to release the, edema, swelling, and or pressure around, if it is indeed inflamed via some, nature, right? Or restricted and inflamed via whatever, nature. And that is the stimulus your body's seeking to relieve stress. And that's just it. The stress relieves, the tension is off the joint, pressure off nerve, pressure off spinal column. The spinal nerve root has been stimulated, and now all of a sudden the mechanoreceptors that are packed within the ligaments that are sensitive to the pressure, temperature, touch, or manipulation, cavitation, release of the gas bubbles, or exchange of gas release, pressure gradient difference of the joint, thus inhibiting pain receptors, and the brain's perception of pain says, oh my God, I have increased range of motion and reduced pain. And if you can get a joint and or your body to increase range of motion and reduce pain, I promise you, you're going to be doing something that is productive to what's really holding you back, which is something called fear avoidant behavior. Fear avoidant behavior isn't just one thing like, oh, I don't want to put on my socks in the morning because I'm afraid I blew out my back once. Believe me, anyone who's had a really bad back like me, whether it's stenosis or a disc herniation or a disc bulge or an annular fiber tear, annular fissures, or ligamentum flavum buckling, or arthritis of the spine where there's actual bony osteophytes rubbing on spinal dural material and or a nerve root, can relate to putting on your socks in the morning is very scary. But think of it like this. Again, spectrum, guys, spectrum. If you have fear avoidant behavior, it could literally be as simple as, I don't like reaching back and touching my head because my shoulder hurts. All the way through, I can't put on my socks or my back's going to go out. That's fear avoidant behavior. Well, interesting. Everything I just referenced around fear avoidant behavior is active exercise. You're doing a movement. You yourself are doing a movement. It's active. How can you get to that point if you don't have the passive therapy that reduces pain and increases range of motion? Thus, the stimulus, it's not placebo, it's just a real thing that happened to your body, and your neurophysiological, anatomical, biomechanical being recognizes that as something that's positive and beneficial that reduces that fear avoidant behavior. And now you can go from your passive therapy to your active therapy with more confidence and begin to build that resilience. So now you see that when I talked about time being sort of the common denominator, it is in every scenario the common denominator. The question is it possible that you could go with just active movements alone and be just fine? Hey, yeah, happens all the time. It happens to me. It happens to my patients. It happens to you. It happens to everyone. But what about the times that it doesn't? Story time, and I'll make this last less than a minute. Just last week, somebody woke up on a Monday morning. They've been my patient for 4 years. They woke up on a Monday morning. They could not move their neck. They freaked out. They felt like they were in so much pain. They called the emergency room. They got taken by ambulance there, thought, what's wrong with me? And literally said to the emergency people that took her there, the first responders, she said, and I quote, I feel so stupid. I know I'm not having a heart attack. I know I'm not having a stroke. She said, but my neck hurts so bad, I don't know what to do. Well, point is, they said, oh, you have arthritis. They gave her a neuro referral. They gave her all types of opioids. They gave her all sorts of Scabapet and all sorts of muscle relaxers. And she was still in pain up through Friday. And then she called me and she said, my neck is killing me. What should I do? And so I said, come in. Let me examine you. So we did an exam. We got to the crux of things. We did, I think, like one manipulation to like T2. It was so light. We did some muscle work, some vibration therapy. She came into me, that was Saturday morning. She came into me on Monday, 90% better. Chipper, happy. Is it because I'm so great? No, it's because of what chiropractic can do. And because of, it doesn't matter like how much pain you're in. You have to understand like what chiropractic is and what it can do. And then we kind of got like all of it, all the way there. Big adjustment on Monday. And I'm sure we'll work to, give the best advice we can to keep her stable. Because that's what we say, we want to keep people stable. So what was that story time for? To let you know, time didn't really do her any favors over the course of a week. And in less than a day, she was sleeping better, tolerating everything. Think she might have taken a couple of aspirin. Life goes on. Doesn't need the gabapentin, doesn't need the muscle relaxers, doesn't need the oxy perk stuff. She doesn't need that because that's just it. Her body was locked up. It wasn't going to allow her to be in any type of active therapeutic modality that she could have done. Imagine if she contacted one of these guys on YouTube or someone selling a home exercise care therapy thing for the neck. Do you know how much pain she would have been in? Do you know how much self-inflicted damage could have been caused by trying to do nerve flossing, trap stretching, scaling, releasing with a ball? I mean, that is more negligent than like a chiropractor who may not even be clinically skilled enough doing like their best to give a little input into the system passively for the body to start to adapt, which is a whole other story, because I do believe that if you're not clinically competent enough, competent enough, and skilled enough, you're probably doing somebody a disservice in the sense of like the time that you'll spend with them doing a lighter modality. That does not mean you have to like blow up the neck and blow up the upper back and lie them on their side and give them these life-changing adjustments. Only with clinical experience, and I'm going to say this to all the young chiropractors or chiropractors out there that don't have confidence, and believe me, I've been adjusted by some of you out there. It's scary. Just like I've gone to doctors for surgical consult that I think are the dumbest people I've ever met. And I've been very fortunate to sit down with unbelievable surgeons and have successful lumbar decompressive surgery. No infection afterwards, did a great job, whatever. I mean, you can listen to all my podcasts. You can listen to my stories. I still go to the chiropractor because back pain is not something that just goes away. It just doesn't happen. But I don't want to go down that road. I want to say that you got to understand time being the common denominator between all these different therapies we can talk about. You've got to understand the difference between a passive modality like chiropractic and what active modality is, and what it takes to get there and be able to move without fear, and how your body can heal, and when to utilize chiropractic, which if you've listened to this video, you've listened to any of my videos, the answer is always, unless the chiropractor does their job in doing a thorough history and background and finds if there's a reason why you might be contraindicated for chiropractic care. It's very seldom. I hardly ever see it, but it is a thing that does exist. You can't just have it all one way, everybody. You cannot just have it all one way. And with that, I'm going to leave you, and I'm going to say have a wonderful day. Feel free to comment, subscribe, share, like, all the good things that YouTube wants me to probably say. Until next time, everybody, it is Dr. Pearlman.